I'm here with Professor Bayes de Luna, who is a senior investigator in the Catalan Institute for Cardiovascular Research. Antonio, thank you very much for joining us today. Professor Bayes de Luna has been working on intra-arterial conduction disturbances for many, many years, and his work has been published in many, many important journals. But recently there has been a sort of a very important communication to major journals in relation to this discovery. Can you tell us a little bit about what you have discovered?
Well, this starts in the 70s when I was doing a lot of interpretation of electrocardiograms, and I realized that the P loop in some patients was going up instead of on to close just at the same level as the starting point. So we discussed this with several people, especially with Paul from France. He was described that this may be due to a retrograde activation of the left atrium because there was a block in the zone of Bachmann-Van. So then I decided to continue the research started by Professor Puig and colleagues in France, and I realized that there is many people that presents this type of block. But you know that the P wave is the Cinderella of the ECG, and nobody takes care of the P wave, and because it's small, you need amplifying glass. And I was using amplifying glass and take 84 cases published in Journal of Electrocardiography, the criteria, and then in 88, the association with supraventricular arrhythmias when this type of intra-atrial block is presented in patients with what we are saying now.
Right. So when you discovered this atrial conduction disturbance, you knew that you were actually facing an important sort of discovery in terms of clinical application.
Yes, for me it was already an important clinical application because I knew that if a patient with advanced heart disease presents this type of intra-atrial block, this means that in the near future he will present atrial fibrillation.
Right,
but
so it was a predictor of atrial fibrillation.
It's a predictor, especially when it's present in patients with advanced atrial block, and then also the duration of the P wave is also longer than 160.
Okay, and can clinicians measure this easily, or you need a very sophisticated tool to measure this?
Not at all, only the eye. It's a small the P wave, but if you need some amplifying glass, you can use an
so that would be enough.
Glass, but this is enough. So at some moment, 2 or 3 years ago, Professor from Canada decided to follow these investigations, and he realized that it was the time to study that, especially because the interest of people for atrial fibrillation has been increasing a lot. In the 70s, atrial fibrillation was rubbish. It was rubbish. People was giving digitalis, not anticoagulation, nothing.
Right, but now we have lots of medications that can be used.
Also ablation.
And also prevention of stroke, that is an important issue.
And I have to say that Dr. Valenchuk in Canada and Dr. Conde in Argentina and in Brazil, other people, and also finally to publish several papers, the editor of Journal of Cardiology and Juba Bacalova published an editorial saying that this has to be named Bayes syndrome. Really, it is a syndrome. The name of Bayes, okay, I am glad, but I am not fighting for that. I am fighting for the syndrome, because much probably this could be another risk factor of atrial fibrillation that could be put. Okay,
so an easy phenomenon to identify, but the very important one that clinicians can identify and which has clinical implications. And would this mean that you would perhaps anticoagulate somebody in sinus rhythm if they have this conduction disturbance?
Exactly. This is the main objective of us, to demonstrate that patients with this type of intra-atrial block that I am saying are presented in patients with advanced heart disease in sinus rhythm. In our opinion, they have all of them a lot of premature atrial contractions in photo monitoring, and they, in our opinion, need anticoagulation because in a few months or at least or not more than 2 or 3 years we will present atrial fibrillation.
They will develop the atrial fibrillation. But of course you will need to carry out sort of well-designed clinical studies in order to confirm that.
Especially, I think the confirmation that this happened is already done with this paper, but what is not confirmed is that this may represent, if we anticoagulate these patients, a decrease in the number of strokes.
Yeah. But this is an important.
This is the science.
Yeah. So this is an important focus for the future.
This is the science to demonstrate that if we are anticoagulating patients in sinus rhythm, but with a high risk of atrial fibrillation, this would prevent a lot of strokes.
Yes.
But however, you know that has been demonstrated that the atrial fibrillation is not the cause of the stroke. When a stroke appears in the devices that are recording during years the heart rhythm, has been demonstrated that usually there is not a patient in atrial fibrillation. Often he has paroxysmal.
Yes, of course. I think that the embolization depends very much on the sort of these episodes of AS. But in any case, I think your findings are of great interest, and they have been summarized recently in your review paper in the European Cardiology Review from Radcliffe Cardiology.
I have been very, very pleased to do that, because I think this journal will be given this message to a young cardiologist in Europe and also to a senior ones, because the seniors...
A very important message indeed. Thank you very much, Antonio. Thank you very much.